orthopedic exam. How are you doing today? I see. I hope by the time you leave this exam, you feel even just the littlest bit better. So it looks like in particular, we are focusing on the cervical vertebrae and the thoracic vertebrae in terms of your spine. Let's see what else. So we'll be looking, of course, at the neck, at the anterior chest, the posterior chest. We will do some sensory testing, some motor testing, a few special tests, vascular tests. We've got quite a few special little things going on for you. Lots of things happening today. So, did you have any particular concerns that you wanted us to look at, that you wanted to be addressed? Let me just... There we go. Wonderful. So I'll definitely keep an eye out for that. And one thing that we forgot to hit, would you mind just confirming your name and date of birth for me? And is that your preferred name? How do you like to be addressed? Excellent. So, for this examination, I will need to be touching you. Is that okay with you? Do I have your permission to do that? Wonderful. So let's start with some inspection, of course. So we are going to take a look, of course, at the chest here. And I want to look in particular for skin defects, of course. We're going to look for muscle wasting and atrophy. We're going to look for any abnormalities in symmetry, for example. I just want to look at you. Just relaxed here, as well as from the side. And from the other side. Good. Looking at the symmetry of your body's structure. And I also want to have a peek at the posterior body. So I'm going to get up for a moment. And let's take a look here. So the curve of your spine, there are certain names for the type of curve. So up here on the neck, this is your cervical lordosis. And then the spine at the chest here, the thoracic vertebrae, this is kyphosis here. And I'm going to take a look at the scapulae back here for any winging or asymmetry. And if you wouldn't mind just bending forward for me, I want to see if we get any rib prominence on one side or the other. Okay, good. Go ahead and sit back up. I'm going to come back around. Right. Go ahead. I would like to have a little look at your hands, if you don't mind. So if you could show me your hands with your palms to the floor, fingers together. Good, so we do not have a Wartenberg sign, which is good. So if we would have an ulnar nerve palsy, for example, we would get this abduction of the pinky. And you could just open your fingers here. Just having a look for muscle wasting, particularly in between the thumb and the forefinger. Good. Okay, so that all feels good. Now, hands good. So, let's do some palpation. I am going to be palpating all over here. We have the deltoid muscles, we have the glenohumeral joint, the acromioclavicular joint, come down to the manubrium, back with the vertebrae. Just going to come in all over, right? Okay, so I'm going to start one side here. And going to compare each side here. Good, just feeling around the soft tissues as well as the bones and the joints. So coming in medially along the clavicle and then down. So the manubrium is the top part of the sternum. It's going to come in here and feel the ribs as well. And please let me know if at any point any of this feels painful, tender. Okay, and let's come in with the upper traps. So this is the trapezius muscle. And then we have, for example, the SCM, sternocleidomastoid. We have levator scapula, scalenes. If I come back over here, we have the rhomboids in between the scapulae. And I'm going to palpate one side at a time. But we have the scapula. We have supraspinatus right here. If I go down here, we have infraspinatus. Okay. Coming over on this side. To the side of the spine. We have the rhomboid muscle, the scapula, supraspinatus, infraspinatus. Good. And now we are going to move up. So I'm going to come in on the anterior neck. And we're going to get into the infrahyoid muscles, the suprahyoid muscles a little, the hyoid bone. Just give them a little check here. And then here we also have the submental and submandibular lymph nodes. going to feel the occiput and come down the spine. So right here, the occiput, and then we have the first palpable vertebra to C2, come all the way down, all the way down. Each vertebra and paraspinal muscles. Good. Down. So we've got C6, C7, C8, because we've got T1 right here. Good. Any pain or discomfort? Very good. Excellent. So I have a list of different movements we're going to do. So I am going to test your range of movement, and then later on we'll have some other tests for your myotomes. We'll also do some sensory tests for your dermatomes. We'll talk a little bit about those in a little bit. So first, we are just going to do some active and passive range of movement. So first, if I could just have you take your head all the way back and tuck your chin in. So we have extension and flexion. Just do that a few times. Extend, flex. And how does that feel? Very good. And if I could have you do some rotation, one side, back to the middle, the other side, back to the middle. And just do that a couple of times for me. Okay? And we'll do some lateral side bending. So tilt the head, trying to touch the ear to the shoulder. Just a few times here. Good. How's that? Alright, so let's go ahead and mark down. So the neck seems to be all good, at least in active range of movement. So for a few exercises with the arms, I am going to have you point your thumbs forward. Put your hands at your side, thumbs pointed forward. Bring your arms all the way up. All right? Good. And if you could have your thumbs pointed out to the sides with your arms at your side and bring them all the way up at the side. Good. All right, so our shoulder flexion and abduction look good. Okay. Now for our medial rotation, if I could have you try to put your thumb as far up on your back as possible. That one you're going to get a pulling feeling right in here. Okay? How's that? Not too bad? Good. So for some rotation at the elbows here, if I could have you with your upper arms at your side and your elbows or your forearms straight in front of you, so they're parallel to the floor, you could just rotate them outwards and in, out in. Good. Medial rotation, lateral rotation. And if I could have you just bring your elbows up here and down, up and down. So we are doing flexion and extension at the elbow. Bringing the arm up and down. Good. And can you close the fist? Splay the fingers. Okay, can you make a tabletop with your hands like this? Okay, can you bring just the fingers bent? And can you bend the fingers over the palm? All right. Any pain or restriction with any of that? Good. So since we're looking at maybe some issues with the neck, I'm going to take you through a little bit of passive range of movement. I am just going to support your head, and I'm going to move you around, okay? So we are just going to come up here. Good. And down. We have extension and flexion. Extension and flexion. Right, and we're going to rotate a bit here. And the other side, maybe a bit of restriction. Side, 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 good. And then for our lateral side bending, good. Tilt it. And tilt. There we go. So how was all of that? Not too bad. Good. Alright, so we are going to be moving on to our sensory tests, and we're going to test the dermatomes. So our dermatomes and our myotomes refer to nerves, and more specifically in this application, we are looking at them referring to a specific vertebra. So, we have the middle finger, for example. The dermatomes for this finger, these sensory nerves, we can trace that back to the 7th cervical vertebra. So if there's something wrong with the sensation, then we can trace it back to that specific area. Now, sometimes things get a little intertwined, so certain nerves will correspond to multiple vertebrae, but for the most part, we can pinpoint things rather easily. So we are going to start with the dermatomes. We're going to work from C5 to T1. And I am just going to grab, there we go, my little popsicle stick here. And this is going to be for just some light touch here. So we are going to start with the upper arm. We're going to come right in the middle. So if you could just tell me if you feel this touch. Right, and right here. Okay, and does that feel even on both sides? Good, so let's just, we've got C5, there we go. And if I could have your thumb here. Can you feel this? On the other side. All right, and does that feel the same as that? Excellent. So C6, and we are going to come into C7 with the middle finger. Good. All right, and does this feel the same as this? Right. And for C8, we have the pinky here. Other side. Right. And does this feel the same as this? Alright, so let's check some guys off. So we have 6, 7, 8. And then we will come to the medial part of the inner elbow here. So it's going to come right in here. Good. And does that feel the same as that? Good. Now we are going to go in with the brush here. And if you could just tell me whether you feel the brush. So we'll do C5. Good. Okay. C6. All right. C7. Good. C8. Okay, the other pinky. Right, and T1. Good. Now we are going to test the pain receptors, and I'm going to use this little wheel right here for that. So this isn't actually painful at all. I can test it on your arm real quick, but it's just enough of a sensation that you feel just a little bit of those pinpricks, just like this. Like that. All right, so let me know that you feel this. Good. All right. And the middle finger here. The pinky. Good. Thumb. Middle finger. Pinky. And the inner elbow here. All right, very good. Lastly, we're going to test temperature. So this is a tuning fork, but we're going to use it for how cold it is. So just let me know when you feel the cold touch. Good. Here. Good. On the fingers. Good. side. Good, and on the inner elbow. Very good, right? So now let's work on myotomes. So we have quite a few exercises to get through. I am going to have you shrug and hold that position for me. And we'll do this for several seconds. And I'm going to come in and try to just press them down. And I want you to resist me here. Good. All right, so good strength there. You can let them relax. Now I'm going to slightly place your head in a side bend. I'm going to try to push you into the middle, and I want you to resist me. All right. So just go ahead and gently place you like this, so about halfway. And I'm going to try to push you to the middle. I want you to resist me. Good. Side here. I'm just going to push you right there. Good. I'm going to try to press you to the middle. I want you to resist me. Alright, let me put you back. Now, we're going to do some tests with the arms. So I'm going to have your home position, or your base position, is going to be with your arm up, your elbow at a 90-degree angle. We're going to have it slightly to the side. So not in front, slightly to the side, right? I'm going to try to push your arms in, and I want you to resist me, okay? I'm going to try to push them in. Good. I am going to try to push your arm forward, and I want you to resist me. Okay, good. So now I am going to try to pull your arms forward. I want you to resist me. Very good. Now if you could splay the fingers, and I'm going to try to squish them together. I could just have you resist me. Good. Good. Now if I could have you put the fingers together, but push out the pinky finger. I'm going to try to push this in, and I want you to resist me. Just test the ulnar nerve here. Okay, good. We got good strength there. So, we are going to test some reflexes. Oh, are Myotomes so good? And these reflexes also correspond to specific vertebra. And I am going to start with the biceps reflex. So if I could have you relax the arm, I am going to be putting my fingers around the elbow with my thumb in the crook of the elbow. And I'm going to be tapping on my thumb there. Oh, I'm just going to come in with a... Good. And the other side. And wrap my fingers around and just tap on my thumb. Now if I could have your arm, let it relax. And now I'm going to do the brachioradialis reflex here. So just let your arm relax. The other side. Good. If you could lay your arm across your thigh here and just let it go floppy. I am going to be just tapping on the back of the elbow for the triceps reflex. Oh, good. And the other arm. You could just lay that across the thigh. Let it go floppy. Good. And there we go. Last one, I am going to look at the Babinski reflex. I'm just going to take your foot and I'm going to stroke the sole with the blade of my Taylor hammer here. So just allow the foot to relax. And I'm just going to stroke the sole here. There, and the toes splay out. Very good. So now we are going to do some special tests. I'm going to start with the distraction test. I'm going to get up and I'm going to pull up on your head. And I just want you to tell me if any of the symptoms you've experienced, any pain or discomfort, if that goes away, if I pull up on the head. Okay, how's that? All right, so now I am going to move your head. We're going to do a couple variations of the Spurling test. So I'm going to bend the head, and then I'm going to just press it down. Let me know if there's any pain here. Good. Move you into neutral. Side bend you to the other side. Just tell me if there's any pain as I press down. Okay. Now I'm going to bend you down and kind of bring you back a little bit. And then we're going to press down. Good. Come back to neutral. Side bend and come back a little bit here and press down. Okay, and put you back in neutral. So how was that? Yeah, let's get you readjusted there. Is that better? So for Laramie sign, I am going to hold your chin and the back of your head and bring your head downwards. Let me know if you feel any pain, more specifically sharp shooting pain. All right? Now I'm just going to hold onto your head here, your chin, back of your head. Bring your head down. How's this? Oh, good. Alright. Bring it back up. And get you back into position. There. Now I am going to do a shoulder abduction test. I'm going to take your arm and put it on top of your head. Just want you to let me know if you feel any change in your symptoms. How's this? Good? Okay. And what about this? All right, good. And finally, I am going to have you bring your arms up and your forearm is going to be parallel to your side body, and I'm going to rotate your arm inwards. I want you to tell me if there's any pain in that. We're going to bring the arm up, bend the elbow, and I'm going to rotate it in. Okay, how's this? A little uncomfortable but not painful? Good. Other side, arm up, bend the elbow, rotate in. That's good too. All right, no shoulder impingement then. That's excellent. All right, so for our special tests, we just have our Tinel tests left. I am going to bend your head to the side, and then I'm going to be doing some percussion all around in the brachial plexus. So I'm going to take your head and just bend you to the side here. Let me know if you get like a pins and needles feeling as I tap along here. How's this? Oh, good. Okay. And the other side. Bend you here and just firmly tapping all around in here. All good? Okay, good. Put you back in neutral. We're going to do a couple more Tinel tests. So I'm going to do this at the back of the elbow as well. If I could just see the elbow. Okay. Good. And now on the wrist, I'm just going to tap along the carpal tunnel. Good. Other side, back of the elbow. Okay, and the wrist. All right, excellent. So we're going to finish off with some vascular tests and some functional testing. Both of these won't take too long. So for our vascular tests, I'm going to check the capillary refill on your fingers here. We're just looking at the circulation. So I'm going to press, release, and the fingernails and fingers should blanch under the pressure, and then the color should come back within 2 seconds. And I'm going to palpate the radial pulses here. Good. The other side. Excellent. And then I'm just going to take your blood pressure. I grab my stethoscope. And my sphygmomanometer. Put that on there. And attach the dial. I'm going to put the diaphragm of my stethoscope in the inside of your elbow here. Make sure the valve's closed on the bulb. And let that release. There we go. And all the way. Good. Good. And we'll just do that on the other side. diaphragm in the crook of the elbow here. And valves closed. Just a little bit. And there we go. Good. Good. Let me just... Snap my stethoscope out there. Take off the blood pressure cuff. And put that to the side. So, millimeters of mercury on each side. Good. So our functional tests are very quick and very easy. First, I'm just going to have you turn your head from side to side as you're sitting here. Let me know if any of that triggers any symptoms. Okay? And now if you could put your arms up straight in front of you as if you were going to drive a car and turn your head from side to side. Good. All right. And lastly, I'm going to have you get up and walk while turning your head from side to side. Alright, so just go ahead, walk to the other side of the room. And how was all that? Okay, if you want to just come on back. Good. So that concludes our examination here. So I didn't find anything in particular that would suggest, a nerve issue or a joint issue. I think we're dealing with just some muscle tension here, all right? Which is good. That's a lot easier to tackle, okay? Very good. So, did you have any questions for me at all? Wonderful. I'm just going to sign off on your exam. And that will wrap it up. I'd like to thank you so much for coming into my office today. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation or a Throne wish list